Okay, so my name's Anna. I've worked with gender dysphoric young people and their families for the past decade. The first half of the decade was spent in the Gender Identity Development Service in the Tavistock Centre in London. And when I was working there, I was working from an affirmative position and doing assessments, which I didn't think was a good idea, so I left. Then I spent the second half of the decade working psychotherapeutically with young people exploring their gender, mainly in private practice. Recently, I've been invited back in to the NHS to help develop the curricula for staff that are going to be working in the new gender hubs in the UK. For those who aren't aware, it wasn't just me who was concerned in the UK. There's been a lot of concern expressed, and NHS England has employed Dr. Hilary Cass, to review children's services in the UK, and the result of that is new gender hubs. So that's me. So today, I'm going to just discuss the unequivocal evidence that there are multiple routes in and out of gender dysphoria. This phrase, multiple routes in and out of gender dysphoria, comes directly from Cass, by the way. I'm going to very briefly consider the implications of this fact for young people, professionals alike in the current context. But most importantly, I want to share two stories from the clinic, the young people themselves. Now, when Cass said that there were multiple routes in and out of gender dysphoria, it was found to be radical by some. And why was it radical? Because there's developed a very dominant diagnostic, thin, quite linear narrative, I'd say, around what it is to experience gender dysphoria. Obviously, gender dysphoria is now conflated with the identity trans as well. We all know this story, I think, but very broadly. The dominant story at the moment is that we are born trans, it's innate, it's fixed at least. You can realise at different ages, from pre-verbal to much, much later on, that gender identity is more salient and more significant than the body, the sex. And this creates an individual problem, dissonance and extreme discomfort. But it's also a social problem in that this group of people experience discrimination. And unlike maybe other DSM diagnoses, the route out is both thought to be via altering the individual, actually altering the body of the individual. So we affirm the gender identity, socially transition, and then we've heard about the medical pathways this morning. But the route out is also understood in the dominant story at the moment to be societal, in that we should be actively reducing prejudice and increasing acceptance. Another aspect of this dominant story is that doing this is the correct thing to do for 99% of people, that there is medical consensus about doing this. And also baked into this story is the idea that if you don't agree with the story or if you challenge it in any way, you are hurting these people. So that's the story that young people bring into my clinic. But there are tensions between this narrative and, as we've heard, the evidence base, the data, individual testimonies. Lisa will talk, I'm sure, about detransitioners. We know that there are certain groups who are more likely to experience gender dysphoria, suggestive of different routes in and maybe out. And for me, most importantly, there are tensions between that narrative and what I'm seeing clinically and what I've been seeing clinically for the past decade. So let's immediately start talking about a young person. So I'm going to introduce you to Mickey. If you've read Hannah's book, I have a habit of making quotes. And for Mickey, I just love this quote. She just opened up a session one day. Man, I wish I was the protagonist. Oh, it's beautiful. So Mickey came to me at 18 years of age. It was a specific referral to explore gender. She'd just gone off to university, come home and told her parents, I'm transgender. She was really pleased to tell her parents that she'd been to the GP, that she'd received a diagnosis of gender dysphoria, and she'd already been referred to the Adult Gender Identity Clinic. And her doctor had reassured her, you will be on T within the year. And her mum said, well, this is a big decision because you've already come out 5 times. And Mickey was up for talking it out, so she came to therapy. The next slides are, they're against all recommendations for speaking publicly. They're too busy, there's far too many words, but that's deliberate, because I want to give you an experience of what it was like talking with Mickey. Okay, so I said, what's the story? Mickey said, I was this really goofy kid. I was super popular. But around 11 to 14, I noticed that people were policing my gender. I noticed that girls weren't allowed to be funny, but I was funny. So I thought maybe I'm bisexual. So I came out as bisexual. And then I went on one date with a boy, and I came out as a lesbian. We've all been there. At the age of 15, Mickey had met her best friend, Sunny, who's a trans boy. And Mickey had had her first kiss with a girl called Sally. And afterwards, she felt sick. She did not like this kiss. And she thought, I can't do this. But she was in love with a female friend, and they cosplayed being couples, being a heterosexual couple. So Mickey concluded, I'm pansexual, and came out for a third time. When she was 16, she went to the school prom with a male date, and she was beautiful, she was very feminine, she had the fake eyelashes, and she was described as the belle of the ball. And she said, oh, I love attention, but why don't I love this attention? So she questioned her identity again. She said to her friend, Sunny, she said, I hate being me, but I don't vomit when I see myself, so I'm not trans. And Sunny said, you are allowed to be trans. And so she came out as non-binary. Mickey was at university when I met her. She joined the LGBTQ group, and she realised, watching the trans men, that she was quite jealous of their bodies and the transformation that was occurring. And she interpreted this envy, this jealousy, as, I must be trans too. And that brought us up to date. That was Mickey's story. So, intervention. Well, I suggested we slow down. I suggested an extended assessment. We haven't got time today to go into that in huge detail, but essentially we explored family dynamics, coping techniques that are developed in that context, and I gave Mickey some permission to not know, and most importantly, we discussed how to tolerate not knowing and uncertainty and big feelings without having to come to a solution immediately. 6 months later, I emailed the family as agreed, and I got an update from Mickey's mum. Mickey is fine with being called whatever. She no longer she didn't take up the appointment in the adult gender clinic, and her boyfriend was with us for the holidays. 2 years later, I received this from Mickey. I won't have time to go through it. It's a lovely graphic novel type thing. Essentially, it's her describing a process of introspection about her gender identity. I can't read that bit. I was going to read that bit at the end, but I can't read it from here. What I took from that was that Mickey had been going through an ongoing exploration of identity for the 2 years after I saw her. That she was taking time to integrate different parts of herself. The cartoon talks about her relationship with the part of her that she called girl, and the fact that she still identifies as a boy, but she doesn't mind being called her or she. It made me realise that most identity work will inevitably be done outside of therapy. And it made me wonder, what if she'd gone to the adult gender clinic assessment? I'm going to introduce you to a very different young person now, Ronan. And the quote that I chose to describe Ronan's experience is, it's terrifying. So most of my work is not actually gender. I specialise in adolescent mental health and physical health. We have a large practice, and increasingly, young people who come to us with a different presenting problem, physical or emotional, are coming out to us during therapy, and Ronan is one of these cases. So Ronan and I started therapy when he was just 14. They had a history of very severe anxiety and depression, and Ronan was unable to attend school for several years. There were lots of social and sensory issues, and Ronan got a diagnosis of autism whilst working with me. The process of engagement took years, When we started, they could tolerate 5 minutes, 10 minutes of talking. It took a long, long time to get Ronan to sit in the room with me for 50 minutes. So I want to give Ronan a voice. Let's hope this works.
I'm a 17-year-old student trying to do my A-levels. With gender, I've never really focused on it until around the time I started doing puberty, and then I started feeling off about it, and so I decided to think about it. When I was about 13, the idea of being trans came into my head. However, I wanted to be sure, so I spent about 2 years trying to confirm it, pretty much just by doing research and listening to other people talking about it and thinking about myself. And in the end, I came to the conclusion that I was trans. However, I am still talking about it because obviously it's not something that you can just run with. It's a thing that it's identity. It's constantly changing. You can't just have one stick to one conclusion.
I wish I could play you the whole interview with Ronan, because they go on to talk about how their identity developed in parasocial relationships. They didn't have any friends. They were seeking peer support, peer identification via the internet. Ronan finds identifying as trans incredibly helpful. It's helped them re-enter the social world and return to school. It's given them a label with which to negotiate friendships, and also a story to hang their suffering on, I think. At the moment, Ronan can see only one way out of their distress, and it is to transition. Ronan lives with very dedicated parents who also come to the sessions. They have to be very involved with supporting their child because Ronan needs extra help, or increasingly less so. They encourage independence. They're very open-minded about the identity that their child will end up with. And they also describe no history of gender diversity or distress in Ronan's childhood, as Ronan doesn't. And they're highly informed about the context. So let's see if this works. I asked them, what help do you need from professionals to help your child suffer less? It's quite a complicated situation. Is that a fair summary?
Definitely. And not only is it very complicated, it's also extremely tricky to unpick the pieces as they're all so interconnected.
Mm-hmm. Particularly with a teenager, because people with teenagers will know how sensitive they are to any topic that may be deemed to be potential criticism, and how fragile their ego is. So it's really difficult to explore these situations in a manner that's supportive.
And added to that, Ronan is quite taciturn. He's not a chatty teenager. He's more of the monosyllabic type quite often. So it's tricky. It's very tricky to navigate.
This is the slide. I asked them, what do you need from us?
I would say fundamentally don't exclude us. Appreciate the relationship is with the patient. The patient will be the young person, the child going through this experience, but the parents are fundamental. And frankly, we need to have the knowledge and the relationship both with the therapist and with our
everyone
child,
should have access to a therapist
with our child, so that we can support them, because we need to create an environment in which this decision can be made. And if we're out of the loop, how can we do that?
Well, and prior to that, we need to hopefully create an environment where the conversations can happen in a healthy, open situation. And I think you're right. We need to. Every young person needs access to a therapist or a counsellor or someone who can help guide them. Because without that, I think that person really does not have a chance in taking their time and considered steps. But then agreed, we need to, be able to work with that person, with the young person and the therapist, so that we're all coordinated in making sure the young person has a healthy environment in which to make, sensible long-term decisions.
So that was what they, as parents, wanted help with. But what about Ronan? What does Ronan think will help them moving forwards to suffer less?
I will say it is absolutely terrifying to go on the news almost every day and see a new thing about laws being changed to restrict transitioning, or to see this trans person's been found murdered or something like that. And you do see it every day. It is terrifying. I think the best thing someone can do is try to reassure them. You don't have to reassure the person of their gender identity if they're still questioning it, and you don't want to push them in a certain direction. But just try to reassure them of their own safety, and if you're worried about, and if you think their safety isn't something you can reassure them of, then try to help them find a way to get into a safer position. I think for a lot of people, seeing all this stuff is only going to make them feel worse, and is going to compound on the issues they already have, and can push them into more dangerous places mentally. And having an external figure to kind of give them comfort can be extremely helpful.
So really different ideas. And you can see that Ronan identifies that the way out of their suffering is with the group, as in the group. So let's reflect on just two stories. And I'm not suggesting these are an example of all trans-identified or young people experiencing gender dysphoria. They are just two young people. Both would share the same diagnosis, but they represent very different experiences, very different challenges. And in some ways, it seems absurd to think of them under the same label. And they're both doing what they should be doing developmentally. They are trying to explore identity. And they're doing that by constructing their identity in relationships, whether parasocial or not, with their peers, with the best misinformation that they've got available to them. So that what they're doing is right and natural. And they're using this linear story about gender identity. And they're finding it incredibly helpful. Both of them found it incredibly helpful, but also terrifying. So again, baked into the story is it helps and it hurts. What do we know about human beings and anxiety? When we get anxious, we desire certainty. And I wonder about everybody working in this field, existing in this field, the young people, the parents, the professionals. Are we all attracted to a simple linear story that will make us feel less anxious? But of course, premature certainty in this context, at this time, risks medication for these young people, and I think it risks disrupting a key developmental task with lifelong implications. So, routes in and out, the implications for us as professionals. Well, there are unequivocally, it's multiple routes in and out, we know that. But there aren't just multiple routes, there are multiple levels of meaning, and we don't have to take everything literally. There is much to be thought about and considered with these young people, and it takes time. Doing anything less, to my mind, is a disservice. Also, we're working with young people. These are older adolescents, but they are still very much in a developmental process and located in a family. We have to work with the families when that family is supportive and safe. And when we work with young people, we have a safeguarding role. People like Liz and Liam are trusting us with their children. And part of that safeguarding role may be questioning current treatment pathways. So I'm going to wrap up. And I'm going to leave the last words to Liz and Liam, if that's okay. I said, any more messages for the professionals?
I think they should recognise other views. They should be capable of dealing with other views in a sensible and coherent manner. And if they disagree, what are the arguments against? Put those forwards. This shut people down because we disagree is just childish.
It's scary because there's a lot at stake.
There is a lot at stake. Thank you for listening.